Race, climate change, and the pandemic crisis, quite a triple threat right there. Well, Healthcare Ready has definitely been engaged in a couple of things over the past year, specifically to increase COVID-19 vaccinations by addressing information as well as resource needs for under-resourced communities as well as historically marginalized communities. Our overall goal is to increase the acceptance as well as willingness for the individuals in socially vulnerable communities as well as medically fragile communities.
Through 2020 and 2021, we've seen how marginalized communities, they've been more disproportionately affected by disasters like natural disasters and the pandemic. Healthcare Ready has consistently combated a lot of the myths and misinformation to empower the communities with resources so that they can make an informed, positive decision about their health, like trainings and community education programs. We've created many webinars and such tailored specifically towards vulnerable communities. We've also seen through our IC3 project,
we were able to utilize our platforms to share our work and discuss practical strategies in order to support equity at the intersection of emergency management, and then also take in our combined partnerships that we have with the private sector as well as the public sector to not only learn what barriers or what issues and challenges that they're experiencing, but also have that or create an open space to have those discussions to understand what are the areas or what are the gaps that are still present and figuring out ways how we can bridge those things together.
We are really working with several primary care associations in very high-risk areas. Many health centers don't necessarily have the resources in order to respond to those emergencies while still delivering the same quality of care to their patients.
We recognize that there was a need to educate not only government entities, but also community decision makers in order to influence how vaccines are being distributed as well as communicated amongst those communities, and providing resources as well as technical assistance for understanding and implementing equitable distribution. We were able to use our past experiences as well as lessons learned from the previous year to the forefront in addressing the needs of the community where they are.
Like in our vaccine education program, where we've done our Vax chats, which are special webinars with representatives that we've had from underrepresented communities.
One of the things that Healthcare Ready does conduct yearly, which is our natural preparedness poll. This poll is usually utilized to increase communities' disaster preparedness efforts across the nation. From 2020 up until the point of 2021, you can see that communities are starting to pay more attention to what it means to prepare in regards to any disaster or even crisis that arises. What I've seen the most between that initial poll period and then the poll period going to 2021 is that communities were able to grow, actively looking for resources that pertain to them and their questions. And the biggest rise of the challenge of 2021 was pretty much being able to communicate the new COVID-19 vaccines to communities in need, but also being able to communicate it in a way that is digestible for specific underserved communities.
In order to reframe the topic of public health from an equity lens, it's really important to first amplify trusted voices within the communities that are underrepresented, and Healthcare Ready has done a great job in doing that.